Hey, welcome to another video from SkinnyMedic. I have a really cool product here I want to show you guys. This is the SAM MEDICAL Pelvic Sling 2. This is going to be used to splint pelvic fractures in the field. So we're going to splint the pelvis for two main reasons in the field. One is for pain control. You have a fractured pelvis. This is going to be quite painful. You still have nerve endings attached to those bones, and they're rubbing together, things like that. It can be quite painful. Also, it's for blood loss. You have femoral arteries running on either side of your hip there. If those happen to get punctured, you can have a significant amount of bleeding internally without even bleeding out externally. So two main reasons why we want to use a commercial device. Alright, so here's the packaging that the SAM MEDICAL Pelvic Sling comes in. So when you unzip it, this is the actual splint here, the sling for us. And then you have directions. So there's directions on the splint as well. And you also get a card here, so in case in time of emergency, you don't remember how to secure it, you got directions here. So not only do you have a card giving you the directions, you also have it onto the splint. Of course, this is going to be up underneath the patient when you go to apply it, so you'll no longer be able to read the directions once you apply it, so you have the card. So if we take a little bit closer look at the splint itself, it's nice and wide, which is going to distribute the pressure all the way across the pelvis, which is important because you don't want to get too narrow. So you want a nice wide pressure band. Here's the buckle that's going to snap in place when we go to use it. It has two prongs that will snap out right here and hook into these holes here. So put it across the pelvis, this black strap here. As you pull and push tension on it, this buckle here is going to snap into place. Two little prongs are going to pop out, go into the holes right there. You also have a second handle here to help you with the pressure. Alright, so we can do an exam on Ed here. Say that Ed fell off a roof, or Ed got hit by a car, something traumatic happened to him. So he's complaining of hip pain. It can be both sides, it can be one side. But as we do our trauma exam, we can kind of palpate the hip. You're going to be able to feel if it's stabilized or not. Pushing down and pushing in, Fred's going to scream in pain or feel very uncomfortable. You're also going to be able to feel some crepitus, and we mean that by like crunching. Like I'm going to feel the pelvis crunch in. You can maybe see some deformities here, some bruising coming up. So there's a lot of indicators here that Ed has a broken pelvis. Now, obviously we didn't bring our x-ray vision, but we can palpate here and do a good physical exam and see that Ed has a fractured pelvis. Like I said in the beginning of the video, the way we would splint this is to compress it. That's going to help with pain control. And Ed has two femoral arteries running right along here. So if something happens and one of those bones connects with Fred's femoral artery, he can bleed out a lot inside his pelvis. So we want to prevent that. So let's apply the SAM MEDICAL Sling here. So this splint is designed to fit waist 32 up to 50 inch, which they say fits 98% of the adult population. Because Ed here is going to be in a lot of pain, we do want to be careful on how much we move him. You wouldn't want to just log roll him, slide this under here. So the easiest thing to do is to slide this up under him. Now, this belt may get caught a little bit because of the pants here, but we want to just slide this as best we can. Okay, now I can work this down and put it about where we feel like the hip is connecting. So I'll show you this picture here, and this is going to give you where to place the splint. Now this is also on the instructions and on the sling itself, but this is where you want to position it here. So this buckle here is going to snap when we pull it across and we have enough tension pulled. Okay, it snapped into place. Secure this. You do have a grab handle here, so that way if you do have two rescuers, one rescuer can grab here and kind of help you with the compression factor. This is your strap here. This is where the buckle clipped into place. I appreciate SAM MEDICAL for sending me the pelvic sling, giving me the opportunity to demonstrate their product as well, and also demonstrate an assessment on how you can tell if someone has a broken pelvis. So thank you guys for watching. You never know when you'll be the first responder, bring the right gear and the right training. Hey, welcome to another video from SkinnyMedic. I want to show you a pretty cool product here. Hey, welcome to another video from SkinnyMedic. I want to show you a cool project here. Sweating like a mother. So a lot of bleeding we've used, you can So I appreciate SAM Medical for sending this device to me for take a look at and do a demonstration for you. So